Do you have any further commentary just on that piece, on the similarities, differences for Canada and Australia? And I realize this could take hours of discussion, but
So it's like if I could use a metaphor. So it's like you're in a relationship with all your family members. And then you complain to your friends about all your family members. And then your friends complain about your family members. And you're like, wait a minute, you have no right to complain about my friend or about my family members. The dynamics that you understand within your own family, within your own system, are completely different than how someone else is going to look at it. So you really don't understand a system until you're in it. And so, I mean, just as an example, like, I became an agency nurse in Sydney, and they only call me for night shift. And the reason why they only call me for night shift is because I'm on the most expensive tier. And so the way they staff is that they will staff with the cheapest nurses, and the shifts that are available then become only available to higher or more expensive nurses as they go down the line, right? So they're not interested in putting out the most expensive nurse or the most experienced nurse. They just want to fill a position. And so I had an experience, and I won't name the hospital, but I had an experience. I said, oh, that's so interesting. So I pre-booked a couple shifts, and then they canceled me. And they canceled me because they found someone cheaper to replace. And I thought to myself, I said, this hospital is actually going to run into problems. If their staffing model does this, then this is going to be a problem for them down the road. And sure enough, they're all over the news right now for staffing concerns and staffing hierarchy and how they actually staff. So it's really easy for me to kind of, or I shouldn't say easy, it's easy for me to take note of this, even though the positives and the negatives are really not known until you're right in the system. So it's really hard to kind of comment, but just sorry to bring it together. Working in Northern Queensland and Thursday Island, I laughed because this doctor said to me, and they talk in acronyms all the time. We don't tend to do it in Canada, but in Australia, it's all acronyms. And so I'm asking questions, and I, as a nurse with 13 years of experience, I have no issue asking questions. And I'll kind of stop somebody and they'll say, well, what do you mean by that? Or what are you saying with this? And he's like, it's amazing. We speak the same language, but the languages are completely different. So it's like that. It's like, we're speaking the same language, but there's a lot of differences. So it's not until you actually get into the system that you actually start seeing those. And it's really like you kind of have to walk the walk to be able to understand all of it.